Hello, my name is Sarah Lovis, and today I'll be presenting on PCO awareness empowering women's health. This presentation focuses on raising awareness about polycystic ovary syndrome, also known as PCOS, a common but often underdiagnosed condition that significantly impacts women's health in the United States. Polycystic ovary syndrome, or PCOS, is a hormonal and metabolic disorder that affects ovulation, reproductive health, and overall metabolism. It is one of the most common endocrine disorders among women of reproductive age, affecting approximately 10 to 13% of women globally. PCOS can lead to a variety of symptoms, including irregular menstrual cycles, excessive androgen levels, and ovarian cysts. In addition to reproductive issues, it is associated with long-term health risks such as type 2 diabetes, cardiovascular disease, and mental health disorders such as anxiety and depression. Because many individuals remain undiagnosed, PCOS represents a major public health concern that requires increased awareness and early intervention. PCOS was first described in 1935 by physicians Irving Stein and Michael Leventhal. Initially, it was identified as a reproductive disorder characterized by ovarian cysts and infertility. Over time, research has shown that PCOS is much more complex, involving hormonal imbalances and metabolic dysfunction. Today, diagnosis is commonly based on the Rotterdam criteria, which requires at least two of the following: irregular ovulation, excess androgen levels, or polycystic ovaries. Despite its early discovery, PCOS has only recently gained recognition as a significant public health issue due to its long-term complications. PCOS affects approximately 1 in 10 women in the United States, making it a highly prevalent condition. However, one of the most concerning statistics is that up to 70% of women with PCOS remain undiagnosed. PCOS is the leading cause of infertility and strongly associated with the metabolic conditions such as obesity and type 2 diabetes. Women with PCOS are at an increased risk for cardiovascular disease as well. These statistics highlight the urgent need for improved screening, education, and awareness to reduce the long-term health complications associated with PCOS. Addressing PCOS requires a multi-level public health approach that includes downstream, midstream, and upstream strategies. At the downstream level, interventions focus on individual care, such as clinical diagnosis, medication management, and lifestyle changes such as diet and exercise. At the midstream level, strategies target the communities. These include school and workplace wellness programs, community education initiatives, and support groups that help individuals better understand and manage PCOS. At the upstream level, efforts focus on policy and prevention. This includes expanding insurance coverage for diagnostic testing and treatment, increasing national awareness campaigns, and integrating women's health education into healthcare training programs. Together, these strategies create a comprehensive approach to improving outcomes for individuals with PCOS. When addressing PCOS in public health campaigns, it is essential to provide patient privacy and confidentiality. Healthcare providers must follow legal and ethical guidelines such as HIPAA to ensure that personal health information is not disclosed without consent. Informed consent is also critical when sharing information or involving individuals in educational campaigns. Additionally, cultural sensitivity must be considered. PCOS affects diverse populations, and messaging should be tailored to different cultural backgrounds, languages, and health literacy levels. Because symptoms like infertility and body image changes can be sensitive topics, respectful and inclusive communication is essential. There are several important ethical considerations when developing a PCOS public health campaign. It is important to avoid stigmatizing individuals based on symptoms such as weight gain, excessive hair growth, or infertility. Second, ensuring equitable access to healthcare services is critical. Many individuals, particularly in underserved communities, may face barriers to diagnosis and treatment. Finally, the public health messaging must be accurate, evidence based, and transparent to build trust and promote informed decision making. Addressing these ethical concerns can help create a more effective and inclusive campaign. Several organizations play a key role in addressing PCOS through education, advocacy, and support. PCOS Awareness Association focuses on raising awareness and providing community support and educational resources. The Center for Disease Control and Prevention provides information on risk factors and prevention strategies. The World Health Organization contributes global research and health guidance. And additionally, the PCOS Challenge plays a critical role in advocacy by promoting policy changes, increasing healthcare access, and supporting individuals through national campaigns. Together, these organizations contribute to improving awareness and care for individuals with PCOS. Although progress has been made, there are still many opportunities to improve PCOS awareness and care. Early screening and diagnosis need to be expanded, especially in primary care settings. There is a need for more culturally tailored education to reach diverse populations effectively. Access to specialists and diagnostic services should be improved, particularly in underserved areas. Collaboration between organizations like PCOS Awareness Association and PCOS Challenge can strengthen the national campaigns and increase their overall impact. My proposed campaign is titled No PCOS, Own Your Health. This campaign focuses on increasing awareness, promoting early diagnosis, and empowering individuals to take control of their health. Key strategies include social media outreach using hashtags like PCOS awareness, hosting free screening events, and partnering with organizations such as the PCOS Awareness Association and the PCOS Challenge. This campaign would also include educational workshops in schools and communities, as well as advocacy efforts to improve healthcare access. By combining education, community engagement, and policy advocacy, this campaign aims to reduce the burden of PCOS. In summary, PCOS is a common but underdiagnosed condition that has significant impacts on both physical and mental health. Early detection and intervention can greatly improve health outcomes and quality of life. Public health efforts must focus on increasing awareness, improving access to care, and addressing disparities in diagnosis and treatment. I encourage individuals, healthcare providers, and communities to support PCOS awareness initiatives and promote early screening and education. Together, we can make a meaningful difference in the lives of those affected by PCOS. The following is a list of references that were used to create this presentation on PCOS awareness. Thank you for listening to my presentation.